Boy, have I got some new information for you that will absolutely blow you away. Hi, I'm 𝗏𝗏𝗃 𝗏𝗏. I'm a Medicare insurance agent in 46 states across the country. We help people with Medicare. And this week, thousands of my counterparts, insurance agents around the country, are literally freaking out. I brought to you last week hearings that happened in the Senate, and that video has been watched 250,000 times. A lot of people have now drawn their attention to this issue about Medicare Advantage. And now, thanks to you in the audience sharing with people, now we have over 9.2 million views on the channel. Thank you so very much. Agents are freaking out because CMS, the Center for Medicare and Medicaid Services, is doing something directly related to those previously quiet videos from the Senate Finance Committee. I think it's fantastic. You're going to hear some new horror stories this week. I'm going to share a couple of them right from our office. I tell you all the time, we hear these stories all the time. I'm going to share with you one from yesterday and one from today, and then one from a hospital association that came out a few minutes ago. And I've got the video to show you. You don't want to miss it because it's actually what's happening. It's real world stuff happening that when you have enough experience and you have enough contacts around the country, you get to hear things of what's going on and how you can get involved. Now, finally, there's something that you can do to tell the regulators exactly how you feel about this topic we're talking about today, what the proposed changes are to protect you, the Medicare public. And I'm really going to make it easy for you to get involved. So don't go anywhere. Make sure you stick around for that part. Two major ways you can go with Medicare. I'm going to go over them again just so I don't miss one opportunity to share with somebody new the two different ways you can go with Medicare, because 90% of agents in the market today will not show you the original way. So I'm going to show you that real briefly, but just so you know. And then important dates of the annual enrollment period that you don't want to miss. What do you have to do by when? I'll go over that at the end, and then an update on what's going on behind my door back there in this AEP chaos that's going on right now. As of today, 730 people that we are still trying to get back to because our phones are just blowing off the hook. Let me share with you what happened. And this is what I shared with you a couple of weeks ago, the hearings that happened in the Senate, and it's just blown me away. And finally, I've been saying this for years, and all the agents are like, oh, you're full of junk. Really, I've shown you the proof, and now it got called out in the Senate, and now agents are freaking out. You see, there's a compensation cap that has been part of the law ever since Medicare Advantage came out. And yet, parent organizations called FMOs had been funneling cash to my agent friend counterparts. I've never taken this cash, and I think it's sick that agents are like, I can get more marketing money for you. Wait, let me recruit you and come to my organization, and I can get you more money than they can get you. And I've got money for this, and I've got money for that, and I've got a free trip, and I've got a golfing thing I can take you to. I think it's sick, and it's the disgusting part of our industry that has never had a light shown on it until now. And yes, I've been rambling about it for years, and I've shown you what the numbers are. And agents still say, well, your reason why you're biased toward Medicare supplement is because they pay more. They clearly know that's a lie. Medicare supplements pay a lot less than Medicare Advantage plans when you're trying to lure somebody into a plan for the first time. And now people they're listening. It's going to be good. Now, here's what the current numbers are. If we're enrolling somebody in a Medicare Advantage plan, first time in a Medicare or first time on a Medicare Advantage plan, they could be 75 years old, but now they're going to go into Medicare Advantage for the first time. This is what I would make. I would make $762 next year if I put somebody on a Medicare Advantage plan. Meanwhile, if I put them on a plan N, for instance, let me just see if I can pull up my calculator. Probably can't in the middle of all this, but I'm going to try anyway. See if I can pull up the calculator. Can it go? Can it go? Let's see. It's moved over here. Let me see if I can move it over there. So a person typically on a plan N is going to be paying about $82. Let's say $82 a month, $18.04 a month. So for that first year, I'm going to make on that person $216.48 on my Medicare supplement. However, if I put them on a plan G, I'm going to make 26% more than that. That's why agents push plan G. Won't get into that topic tonight, but this is what we're typically making on a person that we enroll in a plan N. Our service doesn't cost anything. We're paid by the insurance company. You don't have to worry about it. We're independent brokers. We shop the market. But this $216.48 is very, very, very typical. And you'll say, oh, but you're going to make more money when you put them on a Part D drug plan. We don't do the Part D drug plans, but if we did, yep, we'd make $100 on that. So now we're at what, $360 for the year. Let me remind you, Put them on a Medicare Advantage plan, $762. Oh, but they're in South Carolina. Oh, we only make $611. That's only double what I would have made had I put that person on a Medicare supplement. So I want you to know that there's a huge incentive, but that is not even the beginning of it. That's only what you're allowed to know. And that's only what you would find out if you Google searched how much do agents make on Medicare Advantage plans. That's not the whole story. Now you're going to hear the whole story. Here's the clip that you didn't hear. Here's the part of the Senate hearings that you really should have heard. And look, this is only 2 minutes, but this is what started the change that you can be a part of. This is the part you really need to hear.
I urge you to engage with CMS to review the practice of add-on broker payments to ensure that unfair practices are inhibited, especially total payments above and beyond the CMS caps. Further, CMS and regulators must remain vigilant in enforcing marketing rules that protect seniors from misleading and aggressive marketing. 3 immediate changes that can be made to ensure that brokers remain sufficiently compensated for assisting beneficiaries. We're also ensuring that health plans utilize Medicare dollars to compete for enrollment based on benefits and quality are, first of all, standardizing and limiting total compensation. So rather than a commission, a total compensation cap. Thinking about creating incentives for enrolling beneficiaries in high quality and value-based plans. And finally, transparency in requiring total broker and third-party marketing compensation so that we can all understand all the dollars that might be flowing through these mechanisms.
Let me start with you, Ms. Hoagland. You gave us an example of what amounts to a jaw-dropping ripoff. You basically said that some of these plans are paying $1,300 or more for a new enrollee. Is it right that when you add all of these extra costs, all of the costs heaped onto the system by these middlemen, this
is what you've never been told. It's not the $600 or the $700. $1,300 per person, even more. These agents are getting thousands, tens of thousands of dollars offered to us all the time to push one Medicare Advantage company, and they'll say, we're going to give you more marketing money. You want more marketing money to help with your payroll, to help with your advertising, to help with billboards, to help with your brochures? Here's some extra advertising money.
Comes to somewhere in the vicinity of $6 billion.
Billion.
Yeah, I would say that estimate might even be low. I mean, truly, I think it's really important that we're recognizing the amount of dollars that we're talking about here. They are quite significant at the benefits of perhaps lower costs for taxpayers or additional benefits for enrollees. So as I said, that maximum commission of $611 per new enrollee, but we're continuing to see this growing trend in paying these field marketing organizations, these middlemen, as you call them, all kinds of additional fees. You can call technology fees, referral bonuses, marketing, health risk assessment, and on and on and on. The list of creative add-ons continues to grow. And so this has really become sort of an arms race and creating this anti-competitive environment where, to my colleague's point here, that folks aren't necessarily being enrolled in the plan that's right for them. They're being enrolled in the plan where the incentive lies. That's the largest.
And the reality is we want competition in the system based on coverage. I'm thinking my friend and I worked together back in 2009. We had a bipartisan bill, and Senator Stabenow was with us on it as well, that would have put the competition in terms of who would get the best for their healthcare dollar in terms of coverage and options. And that leads me to my last question for you. The way we stop the ripoffs in traditional Medicare, and I mentioned, when I was director of the Great Panthers, I'd go to a senior's house and they'd go to the back room and be kind of embarrassed.
He said original Medicare. He means Medicare Advantage. He's so confused. Bless his heart.
You had these fancy subrogation clauses, and you basically got nothing. The way we drained that swamp is we had some core standardized principles around which traditional Medicare is offered. There's competition, but it's competition based on coverage, not who can win the arms race. Is that really what you're recommending here?
Yeah, absolutely. We want what you want, which is, sort of fair and equal competition. But competition ultimately is what is best for our seniors, and making decisions based on the benefits offered, right, not the financial incentives.
So you characterized it as an arms race. Paint the picture of what would happen if nothing is done. Supposing the Congress just says, we're very busy, we don't have time to deal with it, and they're making a good point over there in finance, but we got a lot of stuff on our plate. I share your view. I think there will literally be a healthcare arms race, but paint the picture of what that would look like.
Yeah, I mean, I think the first thing is we would continue to see add-on payments. As I mentioned, there already is a lot of creativity about what these things can be called, and I think we continue to see that number grow and grow if there's no caps or additional transparency. And then ultimately that starts to inhibit competition, as smaller regional plans in particular are not able to afford to keep up in that arms race and continue to make these add-on payments. And so I think that ultimately it does lead to less competition and not things that are in the best interest of the beneficiaries.
She works for a very small, in Wisconsin, Medicare Advantage plan. And what she's saying there is true. It's a little bit self-serving. They can't compete with the large ones. And that's why she's okay with bringing it up. So the administration, Chiquita, she heads the CMS, they went to work. I mean, right after these hearings, they went to work. They put out a press release about what this is going to do, and then they took action. This is going to be in a comment period until I think it's January 5th. You can see it at the link that I will be providing in a minute. They want to know what you think about this broker compensation thing. Yeah, there are 12 other things that this directive, this rule will implement. Some of the things are really good. They're talking about prior authorization. Not talking about fixing it in this rule. They're talking about making it transparent so that every July, what they did the last year on prior authorization, how many people they denied, how many people on disability did they deny for services and so forth, and how many did they approve and why did they reject them. Those numbers will be apparently made public if this rule goes through. But man, I'm telling you what, agents are freaking out about this compensation plan, because what they're saying is, it has to absolutely be based on the max. If they're going to say $623 for the year, that's even too high. But all the extra thousands and thousands that agents are getting, they're saying that now they can't be any more add-on money. No more money coming like under the table. And that's literally what it was. It was disguised as marketing money. And so agents everywhere have been getting this news and totally freaking out. You can see it on their Facebook groups, on the groups about insurance all the time, webinars happening right now. They're trying to get the agents to get involved and comment and say, we need our fair compensation. Don't put limits on our compensation. Well, if what was made public for your compensation was actually what you get, that's even fair. Okay, so you're making double what we make on a Medicare supplement, and you're not telling anybody about Medicare supplement. You're telling people that's exactly what they have to do to get in an Advantage plan. That's fine, but when you add thousands of dollars on that to go to one plan over all the others, that's a bunch of junk.
I was told that I could make great money by selling Medicare Advantage plans. What am I going to do now?
Let me share with you some real stories that I've heard in my office this week, and I've cut out their information. There's no personal information here, but I want you to hear it in their own words because you can hear what's going on. There's 723 people we're trying to get back to and work with before December 7th. These people have to get off their Medicare Advantage plan. People want to change their Medicare supplement. This is not really the time to do that. I'll go over the dates on what to do when here in just a minute. Please stick with me, but I want you to hear in their own words.
Medicare Advantage so I could have silver sneakers and
wait, let me play that.
I went to Medicare Advantage so I could have silver sneakers and be able to exercise at my Y. But now I'm having a bad back problem. I've not had surgeries or anything like that. I need to go back to Medicare, but can I go back? What will happen? So please, please, please help me. Thank you.
Into a Medicare Advantage plan, and I'm being denied every left and right and right and left, and just it's an unbelievable thing I'm going through. So someone could return my call, I'd appreciate it.
All you brand new agents out there on YouTube, welcome to the channel, welcome to the industry. And I noted that your license will be a year old here soon, in a couple of days. I just want to let you know this is reality. And if you don't have passion about your industry, what you're doing to help people, yes, and you're always telling me that the book says that only 13% of prior authorizations, there's a study that showed this is the real world, Junior. This is what's really happening.
Share a couple of patient examples. I think that would help really highlight the struggle with Medicare Advantage plans. We had a hospital medical patient that needed placement. Medicare Advantage required authorization. They denied. We appealed because we always advocate for our patients and received a final denial. That patient ended up being discharged home when they were unable to cover the self-pay charges for skilled placement, which we all felt that they really needed. Unfortunately, they were readmitted 3 days later, despite our best efforts to advocate for the patient. One more example, we had a hospital surgery patient who had external fixation for a pretty extensive orthopedic procedure. Medicare Advantage required authorization for skilled placement. They denied for medical necessity. We appealed and had to go through the peer-to-peer process with our provider, where they gave us a 4-hour window. The provider has to take the call or call back in a fixed time frame, otherwise they'll uphold the denial. In this case, we were fortunate the denial was eventually overturned, but our patient had an extra 10 unpaid hospital days waiting for us to work through that process. And again, this is just very frustrating for patients and their providers. And I think it's just really important for Nebraska community members to understand really how much this can affect their care if they end up electing Medicare Advantage plans.
It's not my words. That video came out today from the Nebraska Hospital Association on their channel as in a press release. That was a video press release today, November 10th, as I'm sitting here with you, because it's that important that they want people to know. That's why hospitals are shutting down. That's why you're getting denied care, because they're taking the difference with how much they're paid, about $1,000 a month, and they're taking that difference and not giving you the care for it. And this is routine. This is not some weird thing that happened. It's just routine. All those stories are in the last 48 hours that came through here, because I'm watching and I'm listening the voicemails that are coming in, and we're listening to the stories of the people that we're trying to deal with. Please like this video. And more importantly, please subscribe to the channel so you don't miss an update on what's going on with Medicare, and hit that notification thing. It's very, very important that you stay up to date. There are changes coming out. This time I'm about to show you how you can get involved. And you really need to, if you care about your fellow seniors that are getting on to Medicare. And please, for the love of Jiminy Cricket, share this information with somebody who's turning 65 soon, and they will be faced with the two choices I'm about to show you in a minute, because most agents will not show you the other side, or they'll say, Medicare supplement costs too much. Nobody can afford those. By the way, I continue to delete about 20 of those comments off of my channel every day from other agents who say, we can't sell supplements. Nobody can afford them. Really? I got 15,000 other people that can say otherwise, and I'm just one little pebble in the sea of people helping seniors out there with insurance. So please check that out. Here's how you can get involved and comment. This is the ugly way. I'm going to make it easy. You could go to their website, send in mail, send in priority mail, but I made it easier. You're going to go to this website, but I made it easier than even this. So you don't even have to type anything. If you have a cell phone, a smartphone, you can get it ready. Hold up the phone and hold up the screen in just a second. And it'll take you to the comment page. Unless you're watching this on your phone, you can watch it later. Go there. You can go to that website, and then you type in that number. That is the regulation, where this is one of 12 proposed changes to happen for 2025 in the compensation with agents. And I'm the only agent in the country that will tell you this is a good thing. And I think you should comment that agents do not need to be paid under the table secret amounts of money that is above and beyond the legislative cap that CMS has said they should only get, the $623, et cetera, depending on the state. They don't need to be paid under the table. They don't need additional marketing money, and FMOs need to stop bribing people. So when you go to the page, you just hit the comment right there, and you can read the whole document while you're on the page too. If you have your phone, I've got my phone right around here. You can hold this up to this QR code, and like you're going to take a picture, you pull up the camera and you just scan it there on the screen. From even far away, it will work. Let me make it even bigger so you can see it easier. This will take you right to the page where the comment is. And please do leave your comment. Let the regulators know what you think. When they do the final rule, it's kind of cool because they actually make references to and they make changes based on the public's commentary on the proposed regulation. These are regulations done just exactly because of those Senate Finance hearings. And there's going to be more. I'm going to tell you all the other parts of this proposed regulation, because there's some of it that's really, really good if they implement it. And there are some other parts of Medicare Advantage that will be kicking in 2024 that's going to be exciting, but nothing to help you right now. But anyway, scan that. You can come back and play this again in the video if you need to. It'll also be in the description of this video below. If you need to pull up the description later after it's live, you can see that. There are two ways to go with Medicare. Two ways to go. One, original Medicare. That's what you paid in for your whole life. Part A is in inpatient hospital. Part A is outpatient. Then you can get a drug plan specifically tailored to the drugs that you take. Then you can get a Medicare supplement plan to plug the holes of original Medicare that it doesn't pay for, which is about $1,600 to walk in the door of a hospital for an admission. 20% of all the outpatient charges are not paid on original Medicare. That's why a lot of people like the Medicare supplement policy. A plan N is the cheapest, and it's good if you don't go to the doctor more than 10 or 15 times a year. If you do, you might want the plan G. But just in full disclosure, the plan G pays us, the agents, more because the premium is more. On original Medicare, your claims are paid automatically, and the Medicare supplement pays its portion automatically. There's no medical director on a Medicare supplement that can deny you a claim to be paid. It's paid through a thing called the coordination with original Medicare, and it's just automatically paid. And then you have Medicare Advantage, which they call Part C, but it's not part of Medicare at all. It's a replacement for Medicare's, in fact. And I'll show you another commentary on that in just a second from the Thom Hartmann show that just happened today. That'll kind of blow you away, but really put in perspective. That has a built-in Part D drug plan too, but it's not tailored to you like this one could be. No, that's just rolled into the Medicare replacement plan that they were allowed to get away with calling Medicare Advantage. On Medicare Advantage, one of the constant staples is that access is routinely denied. Prior authorization is required for anything that's going to cost them money. You have to get referrals in most all cases to go to a specialist, and they have a very limited network that you can go to. The doctors that agree to get one payment per month, regardless of how often you go. Doctors are incentivized to see you less or quicker because they've already been paid on you. On original or fee-for-service Medicare, doctors are only paid when they do something for you. And whatever they say that you need to have done is done and paid for automatically. We had stories and stories and stories, and you just got to watch some of our videos when I share with you the differences of our clients that went on original Medicare or they went on Medicare Advantage. And yes, we represent both. You could get either one through us, but we're going to give you the education that you know what you're giving up if you go to original Medicare. If you go to Medicare Advantage. Listen to this from today.
Probably, if you're alive and you're watching television, you're seeing ads for Medicare Advantage. Medicare Advantage is a scam. It is private health insurance. When you sign up for Medicare Advantage, you are giving up real Medicare. You're just leaving it all together. And the Medicare Advantage companies then will insert themselves between you and your doctor, between you and your hospital, between you and your radiologist, between you and your lab, between you and, any medical procedure, and decide whether or not they will pay for it. I had a caller yesterday who said, well, the law says that Medicare Advantage providers have to cover everything Medicare covers. Well, yeah, they have to, except they don't have to pay for it. They just have to consider paying for it. Seriously.
It's true.
Probably, if you're...
Let's see. Oh, here we are. We're in the annual election period where every senior in the country, more than 50 million, want to review their Medicare coverage. And it's probably because Medicare keeps sending out these emails like the one they sent today, and I'm on their distribution list too, of course. And they said, you have to look at your Medicare coverage right away. So everybody's trying to fit through this tiny portal to have all their Medicare coverage reviewed. The period of time every year from October 15th through December 7th is only for Medicare Advantage or Part D drug plans. And you can see your Part D drug options at a website called startpartd.com. You can look at it 24 hours a day, startpartd.com, if you want to look at your drug plan options. We also have a direct-to-consumer Medicare Advantage site if you want to look at that and see what those Medicare Advantage options would be. Do I have a place where I can show you what that is? Yes, I do. You can look at MedicareAdvantageNearMe.com. You can see what the plans are, what their giveaways are, and all that kind of thing. But I want you to be aware that Medicare supplements do not have to be reviewed during this chaotic period of the year. As a matter of fact, it's better if you don't do it right now, because the underwriting departments at the insurance companies are backlogged like crazy. We're backlogged like crazy. And the reality is, all year long, you can change your Medicare supplement. You can start one if you didn't have one. You can change different companies. You can go somewhere else. All year long, you can do Medicare supplement. The worst time to do it is to do it right now. You could review your drug plan, absolutely, but you don't have to do that now. Save you some time. If you're past your initial election period, that is, you're 6 months past your Part B start date. In most all states, you have to go through underwriting. How does that process work? I made a website for that down below, seniorsavingsnetwork.org/underwritten. And it's a video that explains the underwriting process. How do you get a Medicare supplement? How do you get underwritten? What are the types of questions that are asked? And then after that, it has green, click here if you think you'll qualify. And then red, click here if you don't think you'll qualify. But it really makes it simple, because that's the number one question we get asked in our comments on YouTube.
Benjamin Franklin once said,
here's a way to contact us as well. If you got your phone, you can scan that little thing there. It'll take you to our decision tree. The decision tree is where it's asking you, what is it that we can help with? Click on what your scenario is, and I'll give you the rundown as to actually how to go get that taken care of. So if you go to seniorsavingsnetwork.org, or let's see, does that work on the clickety-click being that small on the QR code thing? Turn around just to make sure. Yes, it does. Don't call our phone number, and please don't call our phone number and just leave us your phone number and just have no idea why you're calling. We have to know why you're calling so we can prioritize. We're doing that thing where it's called triage. We're trying to help as many people as we can, but it's really imperative that we help those people that have to do something by December 7th. Oh, let me go back to that timeline for just a minute, if I can. There's another period of time for those of you that are on Medicare Advantage that want to look at your options to get off of it and maybe go to a Medicare supplement. That period of time is January 1st through March 31st. You'll note here you can do it until December 7th to look at other Medicare Advantage plans or get off of it. But between December 7th and January 1st, there's nothing you can do during that period. So it starts up again January 1st. You can change or drop your Medicare Advantage plan. Little caveat, if you drop your Medicare Advantage plan during the open enrollment period they call January 1st to March 31st, they allow you to get a standalone Part D plan during that period of time for the new year. So you can get a customized Part D drug plan just for you and your list of drugs if you decide to drop your Medicare Advantage plan during that period of the year. We are super busy in the office, I'll tell you, but we are doing everything we can to help everybody we can. Why am I doing videos during this period of time? Because we're getting lots and lots of comments and questions on the interwebs. And so I want to do all we can to answer those questions. I'm going to go into, well, let me switch this over so I can answer questions right now and take them live. If you have any questions, put them in the comments. I've been looking at these and I'll pull them up now. All right, how are we doing? Switch. Okay. Still coming in. Thanks y'all for that. And somebody just mentioned the, in the comments, they mentioned the hospital shutting down. Yeah, that's a very, very sad situation that we've been monitoring, and I covered that just the other day. See if I can show you that one again. Yeah, here it is right here.
When we first heard that 𝗪𝗡 had decided to close this hospital permanently, the community was in a state of shock. Anger, disappointment. We thought it would always be here. When bad things happen in our lives, we like to blame people, and there was a lot of finger pointing.
In rural towns across the U.S., hospitals are in crisis. Just take Mercy Hospital, Fort Scott, a nonprofit 46-bed facility in southeast Kansas. After 130 years, the hospital didn't have enough money to keep going. For the community, the news was crushing.
When we got the announcement that the hospital was closing, myself and my wife, we were devastated. We were like, okay, well, that's the worst thing we've heard. The community took it hard as well. The CEO would get death threats even though it wasn't her fault.
Yeah, pretty sad. Let's see, what do we have? Lots of comments coming in, and I'm answering those while typing while the other things are showing. Lots of commentary about Nikki Haley and her support for Medicare Advantage. And, you know, God bless her. This is not her expertise. I met with a local congresswoman. Gosh, I shouldn't have said that. Local person in elected leadership in Washington, D.C. I met with a few weeks back, and there's just not a lot of depth on the subject of Medicare. Didn't even know what the annual election period was or why anybody's talking about Medicare right now. Very sad. We got to do a better job of educating our elected officials. At least some of the regulators were watching the Senate hearings on this. Thank goodness. Let's see. Talking about an insurance company, can't make that one public on here. Somebody's got personal information. Yep. Don't put your personal health information in the comments. There's a lot of other parts to the proposed regulation, and you should read it for yourself, but I'll be going over some of the other parts of that here in the coming days. Some of it's really good. Also, an article came out today from a friend of mine, Cheryl, who's a fantastic reporter, talking about proposed changes to Medicare Advantage from MedPAC, and that's going to be pretty good. Hopefully some of that stuff will get passed, and if so, it's going to be real good. I'm looking for the comments. If y'all have any more in the live stream, feel free to put them in there. Actually, let me see if I can pull her stuff up here, since 400 people are hanging out. Talking about the latest stuff with Medicare. This just came out. Like going over the things that just come out about Medicare because we're timely. Oh, that's really cool. Thanks to this video, has changed on time the Advantage plan back to original Medicare plan and drug plan. Thanks to him, I changed my $0 drug plan and to another Part D. Forever grateful. That's awesome. Thanks, EL. Let me show you all what's going on with this. Right. Show this tab. Boom. That gonna work? Here we go. Turn that off. This is an article from MedPage Today, and this would be fantastic. MedPAC advises Congress on all things Medicare, and MedPAC came out with these recommendations yesterday. The article was written by Cheryl Clark, fantastic reporter. Joe, to answer your question, what does Plan G cost in Illinois? We'd have to know your zip code, your age, whether you smoke or not, and if you're male or female. Happy to tell you what those things are if you can go to our website where we have the information. Let's see. No, that's the wrong article. Let me get the website for you. Right here, seniorsavingsnetwork.org, and then the Medicare help button. That pops up real easily there. So this article says, and I'll continue to answer your question as you're going through, 10 ways that MedPAC commissioners think that regulators should fix Medicare Advantage plans. And boy, oh boy, this would be good. And I really think that they should, especially a couple of these here. Watch this. Turn off the, there we go. Gonna turn off the banner thing too. That thing is a little bit annoying. There it goes. Improvements needed in network accuracy and transparency regarding denial rates. This is again in the news. It's amazing what you can find if this is what you study, if this is your profession, and this is what you're interested in all day. Medicare Payment Advisory Commission, MedPAC members wrestled last week on how to prevent a range of frustrations they say that providers and patients are encountering with Medicare Advantage. Isn't that interesting? They don't have these problems with original Medicare. Although the commissioners were just discussing ideas and didn't make any formal recommendations, the MedPAC staff will analyze the commissioners' remarks for possible inclusion in an upcoming report to Congress, a report that will suggest regulatory changes to help make the plans better. This year, Medicare Advantage getting bigger. Okay, look at this. This is kind of cool. And this is what a lot of people have been asking about just here tonight with us. Make a pathway for unhappy Medicare Advantage enrollees with reasonable buyer's remorse. You ever heard of that in the sales world? Buyer's remorse. You wake up the next day and you're like, what did I buy? People unhappy with Medicare Advantage and their buyer's remorse to leave their Medicare Advantage plans and have a special election period to buy a supplemental plan that picks up traditional Medicare's 20% Part B copays and hospital deductibles. It says beneficiaries have limited periods, except in some states like Washington, New York, where you can just get on a supplement anytime you want to. Drop that sucker. Beneficiaries have limited periods in which they can buy a supplemental plan without medical underwriting. Those periods are generally limited to their first 6 months of eligibility, which is Part B of Medicare, or if they leave traditional Medicare later for Medicare Advantage plan, they have a one-time 12-month period called trial right, in which they can go back to traditional Medicare and get their supplemental plan back if it is still available. That's actually the second of the two different trial right. The first trial right is exactly what they're talking about here. I'm surprised that MedPAC people didn't know this. The first trial right is actually just this. If you get on a Medicare Advantage plan, when your Part A start date happened, that's the little trick. So if you went on and you continue to work at your employer plan for years and years and years, and you never activated your Part B because you had qualifying employer coverage, and then you join a Medicare Advantage plan, the trial right's not available to you. Trial right in the first instance is available to you if you started on Medicare Advantage the same day that your Part A of Medicare, your original eligibility for Medicare, did start. That's the trial right, and that lasts for 12 months. And that says that if you get on a Medicare Advantage plan first thing into Medicare and you don't like it within the first 12 months, which is only if you get sick, then you can go back and do a do-over of your initial election period, which means the world is your oyster. You can get a Medicare Advantage, a Medicare supplement plan, any plan letter at all. The second kind of trial right that they're alluding to here is if you are later in life and you try a Medicare Advantage plan for the first time, giving up your supplement, yes, you could get that supplement back, but in our experience in the real world, that never happens. It's gone after 30 days. So they give you guaranteed issue into a Medicare supplement. The problem is you can't get Plan N by guarantee issue. You're shoved into Plan G. So you're paying more now, and you're paying more with the rate increases that are double to triple on having a Plan G. She says, I'm in a state that does not have guarantee issue rights for supplements outside of very restricted periods, said Gina 𝗏𝗏, founder and executive director of Senior Pharma Assist, nonprofit in Durham, North Carolina. Quote, we see a lot of people, so do I. We see a lot of people that really cannot make the selection to go back to traditional Medicare with a supplement plan because they would have to go through medical underwriting. If a member attests, that just means legally a person says so. It's just true because I said so. If a person attests to a reasonable buyer's remorse, that's not a legal term, by the way, a reasonable buyer's remorse, that's part of a legal term called the reasonably prudent person, which is what a normal person would be subjected to if they acted under like the Samaritan law. Anyway, legal. If a member attests to a reasonable buyer's remorse, they should have guaranteed issue back to traditional Medicare. What you don't understand there is that would completely screw up the entire Medicare supplement world, making everybody's rates skyrocket like the geniuses in the state of New York did, in California with the birthday rule, and now Illinois, and now other states that are doing birthday rule guarantee issue periods. The rates are through the roof. One of our agents in here, Maxwell, said to me yesterday, I just had somebody move from Ohio to Missouri, and they're shocked because their rate is so much lower than all of their friends in Missouri. How can that be? Because Ohio doesn't have a guarantee issue period like Missouri does every year with the anniversary rule. And sometimes when these states pass these things, all well and good intentions, so they can give you more opportunities, and put it to the insurance company, the unintended consequence is the rates go up for everybody. Compare for me. I'd love to do it for you. Hell, I'll do it right now because I like to show you when things are what they are and they're real. I want to show you a rate in New York City versus a rate in Charleston, South Carolina. And let's see what the effect of regulatory concerns have when it actually hits the fan and you want to get everything for, no qualification whatsoever. See if I can share the entire screen over here. Can I get the whole screen, please? There we go. So somebody give me a zip code in New York City. Our agent site. Let's see, New York City zip code. I'll just pull one at random. They are zip code specific. 10005. 10005. And I'm going to look at it. Let's the youngest that they can possibly be, right? A 65-year-old female. Oh, that didn't show up. Am I showing that screen now? Something got stuck, folks. Hang on. We'll get it going. 1005. 65 female on Plan G. Nope, Plan G. Let's see what those rates start at in the wonderful New York. United Healthcare has the best rate on a Plan G at $281.50. That's brand new to Medicare. Brand new. That's the lowest rate available. That's New York City for you. Why? Because New York State has the law that says anytime you want to, walking down the street, you go, you know what? I want a Medicare supplement. The law allows me to do it because we did it to the insurance companies. Now let me change this. $281.50. That's the cheapest, and it goes way up from there. Let me look at where I live. 29466, Mount Pleasant, South Carolina, in Charleston County. Beautiful South Carolina. They call it the Low Country. I still don't know why. So $281.50 would be her brand new to Medicare rate on a Plan G. Now let's look at a state that does not have a guarantee issue period. Look at that, $93.65. And it's even better if you go through the household discounts, which are allowed in other states besides New York. Literally $130 difference per month starting off, and everything, a rising tide rises all ships, right? So yeah, that's the effect of what they're talking about with this MedPAC solution here. That is to give it all to everybody and just make them take it. Not a real good solution because it will absolutely impact everybody else in a negative way. I mean, the theory, it's great in theory, but in reality, that ends up hurting everybody else. If I can attest to the reasonable buyer's remorse, give me a traditional Medicare supplement with no health questions. That's ideal from a public policy standpoint. Okay, yeah, sure is. People need to understand, this is the important part, y'all. People need to understand that if someone is in Medicare Advantage and for whatever reason doesn't like the prior authorization or the networks, you really don't know what's going to happen to you. So switching back to traditional Medicare would be important. Say it ain't so, said Larry Cassillo, a doctor, former head of health policy at Weill Cornell Medical School. Yeah, you really don't know what's really going to happen. And that's the whole purpose of insurance. Require Medicare Advantage plans to have up-to-date provider directories. I've got a whole presentation to show you about ghost networks and how that's legitimately part of the operating procedure of Medicare Advantage, just to have fake networks that they publish for your benefit, only to get suckered in and enrolled and then find out there's no such thing in here. Holy cow. They need to study Medicare's rules for assuring, study the rules. The rules are already there, but nobody's enforcing them. Study those Medicare rules for assuring that Medicare Advantage plan enrollees can get in-network coverage for medically necessary care with out-of-network specialists. It just doesn't work that way when the plan has no appropriate in-network specialist that can meet the patient's need. Who monitors that? And do we see that a lot? Yeah, we do. People that work with people that are on Medicare Advantage. We see that all the time. Is there any network adequacy addressing that now? Nope, there's not. Mandate that beneficiaries have a reliable way to compare plans. Yeah, you should. In terms of prior authorization reviews and compliance of various rules. As I discussed, that's part of this new marketing rule that is supposed to take effect in 2025, so that they'll be able to publish those prior authorization experiences and make those available in July of every year. Revamp the Medicare Advantage plan star ratings to reflect stability and consistency of the provider's network in a way that would include each plan's prior authorization denial rate. Oh, they don't want to make that public. Make that part of the star ratings. Why hasn't that been the case up to this point? That's pretty much the whole thing. You're going to make me die and wait for coverage and appeal to 5 levels, or are you going to give it to me? Maybe that should be encompassed in the star rating. I think it should. You know, we need to figure out how to pay people. So it feels like we should be able to tie these things together in a way that really makes it clear who is available, who's accepting patients. Say it ain't so. Oh, this is my favorite. This is the recommendation from the MedPAC folks to CMS and to Congress for how to improve Medicare Advantage. Watch this. Find ways to make sure beneficiaries know what they're giving up when they enroll in a Medicare Advantage plan. Wow. With respect to being constrained to narrow provider networks and accepting delays or denials of care because of prior authorization. But wait, some new kid on YouTube that sells insurance for his company said, this is not really a big problem. Why is this board that only does Medicare studies all the time and reports to Congress every year? Why are they saying that this is a problem that we need to educate more on the senior side? Well, I wish there was somebody on YouTube or on the public that was actually educating seniors on this crap. There actually is. Anyway, quote, anything we can do to help people understand what they're giving up and what they're getting is, I think, an absolutely central principle, said Betty Ramber, professor of nursing at the University of Rhode Island. You're darn right. You should make sure that people have this. First of all, let me tell you this. To protect seniors, they make us get what's called a scope of appointment form. Oh, this is genius. This is just government regulation in full effect. The scope of appointment form says that you have to agree that in your conversation with your agent, you check a box and you sign your name and say, it's okay if you talk to me about Medicare plans. We have to get the permission slip. So if you want to talk to us, for example, about a Medicare Advantage plan that may be available in your area, I made a website for that. Makes it super easy. It's called Sign My Scope, scope of appointment, signmyscope.com. You go there, you sign this permission slip, then it takes you to our calendar and you pick when you want to meet with us. Really cool, huh? Signmyscope.com. Anyway, they thought that making this scope of appointment a hindrance between us and the senior client, it's going to do something great for them. I've got an idea for you, CMS. How about you make this disclaimer mandatory on the scope of appointment? I, the senior, hereby understand that by giving up original Medicare for the time period of January 1 to December 31 of next year, I will not be able to use my Medicare red, white, and blue card. It is useless. Rip it up or put it in the safe because you can't use it while you're on Medicare Advantage. I understand that I can't use Part A benefit of Medicare that I've paid into my whole life, which means I can't go to any hospital facility in the country. Just can't do it. I understand that I can't use my Part B benefits of original Medicare that I pay a premium for every single month. I can't use it, but I still have to pay for it. I understand that I'm going to pay for Part B, but I can't use Part B, which means if I need an MRI, a CAT scan, a CT, an EKG, and all the rest, I have to get prior authorization. Your insurance company has to say yes. And I have to use a facility that's going to pay the cheapest or take the cheapest amount of money, basically, because that's what the Medicare Advantage is trying to contract with. So I pay for Part A, my life. I pay for Part B every month. I can't use that. I understand that my drug plan on a Medicare Advantage plan will just simply be packaged in there and may not be specifically tailored for the drugs and the pharmacies that I use. It's just an all-in-one plan that the commercials on TV are always saying, this is fantastic. It's all in one plan. It's a crappy dental. It's a crappy vision, but we say that you've got benefits, so it's in there. Check that box. And we say that you've got a drug plan in there. Is it the best one for you? We don't care. It's packaged in there, baby. And you can just say all in one plan in your commercials. Yeah, have that in the disclaimer that agents that are out there getting paid triple what they should right now, shoving Medicare Advantage all the time and saying, it's free, just sign here. It's free money. Like I showed the commercial the other day. It's just like free money. What a bunch of junk. Put this as part of the agent's disclaimer. Then you'll really be doing something to protect seniors. Sorry, I didn't plan to go on that tangent. Require that Medicare Advantage plans list behavioral health plans in their directories by provider name rather than just giving the patients a phone number to call. Got a great story about that just happened in the Senate hearing about behavioral health. That is actually one of the 12 things that they're trying to get into this rule. Improve the user friendliness of the appeals process. Oh, if that isn't hell on earth. Imagine you're sitting in a hospital, you can't go anywhere, you're stuck in the hospital, your doctors all agree that you need a surgery, but that surgery is going to cost money. So the Medicare Advantage company says, hang on, let's just review that. And maybe put your orthopedic surgeon on the phone with a podiatrist, as we covered last week. Maybe put it on the phone with an OBGYN, which is your peer-to-peer consult that you have to have with the Advantage plan. Your OBGYN's like, wait, you need a third CT final spinal fracture sutured up, whatever. They're not going to know what you're talking about. But you have to go through that process. And then when they say, nope, that costs a lot of money, denied. How about a cortisone shot? Will that make you feel better? How about some PT? Physical therapy? No, it's called pain and torture. Go through that first, and then we'll consider the surgery if all these lesser included things don't work. Yeah, improve the user friendliness of the appeals process, because you're at the worst part of your life when you're suffering just like I described, and yet it's your job to represent yourself to appeal and a phone interview, and a phone interview with your doctor has to be there. You have to talk to their people, and then you finally have to go in front of a administrative law judge with Medicare. Yeah, do all that while you're sitting in the hospital bed. Quote, the more we make that an easy remedy, the more plans will back away from unnecessary denials on the front end, suggested Sarin. Chernu stressed that Medicare Advantage plans were designed to reduce unnecessary care and use the savings from that to add on other benefits and reduce premiums. But that doesn't mean there aren't situations. That's a double negative, y'all. A double negative means it's a positive. That means that is happening. That doesn't mean that there aren't situations in which care is denied that shouldn't be denied. State ain't so, Joe. Or that the quality of the plan is worse than it would be in fee-for-service original Medicare. Did he just say that? It doesn't mean that, yeah, it does mean, and it does mean that it's worse because it's a double negative. Getting the balance between getting to efficient delivery systems, managed care, versus the potential for Medicare Advantage plans to be overly aggressive. I love that. Overly aggressive is a challenging thing for CMS. They emphasize that everyone agrees beneficiaries need to be better informed about the things they give up. They give up. Wait, all the sales agents out there say you don't give up anything. You get free stuff. It's free. They should be more informed about the things that they give up over fee for service. But given the complexities of the plans, that's a daunting task. Oh my gosh. It's just about enough to make you sick. Like, seriously, that's disgusting. All eye-opening. We have been, all been educated and warned. I'm eligible for Medicare for the first time in 2025. I will be going with original Medicare. Please stay tuned, TW. Things are changing every year, and they just saunter around these proposals to make changes. And by 2025, who knows what we're going to have by plan offerings. But I'll tell you what, this crew will be standing by to help you. That's for sure. Let's see. My friend also showed me a catalog of medical supplies that she could choose from with the free money she gets monthly. They were charging $6 for a bottle of alcohol. Doesn't sound free to me. Nice. Let's see. There should be a class action lawsuit for financially abusing seniors. Yeah, I fully agree. Thank you, Edwin, for saying that. California Advantage Care, fake Medicare, and Medicare supplement. Okay. Oh, it's talking about Lyric. Thanks, Christopher. Our sales rep, Lyric, just talked to my husband into getting off of his Medicare Advantage and going back to original Medicare. He chose Plan N and was approved within 24 hours. You know, one of the things we just mentioned, we just talked about this morning, actually in our office meeting was yesterday morning. They're all running together now. We're working so late. It is really dark outside. My family's wondering, where are you? One of the things we talked about is the backlog that's happening at Medicare supplement carriers right now. And some of them are really pushing 7 to 10 days backlog. As we get closer to the beginning of December, that always is going to be 2, 3, 4 weeks out from an underwriting decision. So if you want to get on a Medicare supplement and you're not in your initial election period to Medicare, you should get in line for that sooner rather than later. Or the best thing to do is, if you can, if you don't need it right now, do your changing of your Medicare supplements. Do that after December 7th, if that's something that pertains to what you can do. And let me share this one of them, because it took a long time to make this image today, and I'm really proud of it. Check that out. Isn't that kind of cool? It's the Medicare agent getting paid, in this case over the table, but it's in addition to, I'm telling you, these marketing people, they come around my office every year and I shouldn't be sharing this, but one just came a couple weeks ago and he bought us a box of donuts, and that's great. They're always asking like, hey, do you need any marketing money? No, we don't. We don't pay for marketing. We don't pay for leads. We just do things like this that don't cost us money except for time and time away from our families and energy and resources to help people with education. And then they just call in and they let us help them with their Medicare plans. Then they deal with the person that they can trust for all the rest of their days on Medicare. So we don't need your marketing money, and we've never taken it, and we never will. Let's see. Are there any other questions before we get it? If you have health problems, get Chris to help you in your first 6 months. You're eligible. Yeah. And you know what, T-Bone, that's something that I always find funny in that Medicare and You guidebook over there. The people at Medicare and CMS and 𝗲𝗏𝗄, the head of CMS right now, is doing a phenomenal job. She's actually responding in a quick way, much quicker than anybody in the past, to address these things and try to stand up for seniors. I applaud her. But they in Washington don't know much about the Medigap, the Medicare supplement. So there's a very small, very thin section about Medicare supplements in that book. But when it talks about the best time to get a Medicare supplement, it says, when can you get a Medicare supplement? The best time to get one is in your first 6 months of eligibility of Medicare. And that's true. You can pick any plan you want during that period of time. But for the other 49 million people on Medicare, when is the best time for them? And I would say the best time for them is anytime after December 7th and before October 15th of the next year. They can ask us, we can go through the underwriting process and see if they can get qualified for it. But yeah, you're right. Being an independent broker, having access to lots and lots of different companies out there gives us the overall best chance of being able to get somebody approved. That is true, because we do have access to those things. Why would I get a drug plan that costs more than the 2 prescriptions I take? You shouldn't. And you should look at our website or Medicare.gov, or call Medicare if you want. Our website for drug plans is called startpartd.com, startpartd.com. And you can put in your drugs, you can put in your zip code, you can put in your pharmacies, your preferred pharmacies and so forth that you want to go to. And I believe that you'll find something less expensive this year. They should not use the word Medicare with Medicare Advantage. Yeah, there's a bill that was proposed, and I have that in there in my video repertoire. We've covered it a couple of times. That talks about Medicare Advantage is not real Medicare. And yeah, that bill went nowhere because of the lobby in Washington. Not real Medicare. And let's see here. James, that's over what they take about out of my, wait. Oh, good question, Mark. Let's see if I can find this. The question was, if I get a new drug plan, do you need to contact the old drug plan provider? No. In Medicare, on your Medicare, what's called mymedicare.gov login, when you log into your Medicare, and we can see this too through a system called Marks, we're directly tied into Medicare. You can see what your record is with regard to Medicare Advantage or Part D. There's only one slot there. You can either have Medicare Advantage or you can have a Part D plan. You can't have both. So whatever it is that you have there, there's only one slot. So when you sign up for something new, it knocks out the old one and replaces it with the new one. So if you sign up for a Medicare Advantage plan during this period of time and you only had a drug plan before, just by signing up for the Medicare Advantage plan, it's going to knock it out, that Part D drug plan for you. You don't have to cancel them. The only things you do have to cancel are when you go from one Medicare supplement and you get approved at another one, maybe the same plan or a better one for you. Yes, then you would have to notify the prior company, and we help all of our clients with the exact timing on how to do that so that you're never paying for coverage. It's another thing that the Medicare and You guidebook does not get right. It says never apply for a plan when you already have one. Well, you have to apply before you have the second one. It just kind of works that way. But yeah, 2 different ways to go. And let me put our contact info there in case you wanted it. Your crew signed me up for an Advantage plan when I wanted to go to a supplement. Don't understand. All is confusing. Is that a question? I don't understand that. Mary Helen? No, we would not sign somebody up for a Medicare Advantage plan that wanted a supplement. So I'm not sure where that is coming from, or if that's a question. Sometimes you just can't get any context because you have one shot to do that. In California, my thoughts exactly. And he said, what, I missed some stuff here. Are we not penalized by not purchasing Plan D coverage by SSA? whole bunch of things in there that are a little tricky. First of all, it's not Plan D. I believe there is a Plan D Medicare supplement, but there's a Part D of Medicare. Part D is the drug component. I'm sure that that's what you're referring to. So are you penalized for not having a Part D plan? Only if you get one in the next coming year and you didn't have one before. Then you're penalized 1% of the national average premium, which changes every year. 1% of that premium per month that you could have had a Part D plan and you didn't have other qualifying coverage, and now you got a Part D plan. So yes, if this is 2 years and now you're getting one, that's 24 months, that's 24% higher you could be paying on your Part D premium, and that lasts for the rest of your life. Now, if you apply for low income subsidy or you go on Medicaid, then that's wiped out. Or if you had Medicare prior to age 65, let's say you're on Medicare due to disability and you didn't get a Part D drug plan, but then you turn 65, that also wipes out the Part D penalty for life. So 3 ways you can get that wiped out. But yeah, if you didn't have a Part D plan, then you get one later in life, yes, you'll have that penalty and it lasts for the rest of your life. Underwriters are not easy for people with health issues. Yep, that's why we have the website on there of where to go, and you can find out yourself pretty much if you're going to be approved. Let's see. Your crude. Let's see. This is crazy. Medicare Advantage helps a ton of people in the USA. Also, folks are on a fixed income. How Plan F worked out for them in the long run. Not everyone can afford a supplement or pass underwriting. You're absolutely right. And that's why we don't just shove everybody like a round peg into a square hole. We actually listen and find out what you can afford, because some people, it's true, they have champagne taste, but they have a beer budget. And we have to find something that's good for everybody. And so that's what we do. And that's why it's imperative, I think, that you work with an honest, independent broker and not a television commercial like Joe Namath that's shoving one thing in there. And if you pay close attention to those commercials, they're all selling you Medicare Advantage, because that's where the money is. But yeah, it's not for everyone. And if somebody was on Plan F, which I call Plan Foolish, and they kept it and they could have gotten off of it, they didn't have the right education. I can put it that way. We've been talking about that since 2010, about Plan F as a foolish plan to be on. How do you qualify to get back on Medicare? I don't know how you got off, but that would be the first start. You could ask us that question by reaching out to us here. You always start Medicare through Social Security, ssa.gov. That'd be the first place to start. So I'm not sure how you would have gotten off of it. Part D, yeah, Delta Bravo, no problem. I see that. I got the 50-cent drug plan. If my drugs are higher through the plan, I don't use my insurance when I fill the prescription. Betty, that is a great point. That is a great point. Oh, where did I save that video? I just saved it today. I sent it to my people. Let's see if I can find this video. It's a pharmacist that talks about how when a senior comes in and the senior's on a drug plan, he's not allowed to tell them that they could have gotten that drug cheaper directly. Let me see if I got this right here. Can I just show this way? Is this even legal? Hang on, let's see if I can find this again. Share. And let's see if they got the audio going. You really should hear this.
If you come into my pharmacy, if your grandma comes in and she tries to fill a prescription, I'll give you metformin. My cost on metformin is roughly $2. I would sell her metformin for $4. As soon as she discloses that she has insurance, I have a gag clause. I am not allowed to tell her my cash pay price. I swipe her insurance card, Blue Cross, whatever it may be, boom, copay $10. And she gets her medicine, I charge her $10. Immediately when I swipe that card and I enter all that in the computer, I get a $7 clawback. Where does it go? It goes to the PBM. So you get what like I could have saved her $6, but I can't disclose to her that. And now the money, the profits, I make less money, she pays more money, and the money goes back to the big insurance companies. If you come into my pharmacy, if your grandma comes in and she tries to fill a prescription, I'll give you metformin. My cost on metformin is roughly $2. I would sell her metformin for $4.
Yeah, you should always find out what the cash price is. The other thing is it'll push you into the donut hole if you're always using your drug plan and you never explore other alternatives for high cost drugs that you might find at Cost Plus Pharmacy. You might find at GoodRx. You could Google it and find out if there's a direct benefit from the manufacturer of that drug. You've got to become a detective, and you've got to investigate where you can get a high cost drug other than just your Part D plan. Don't just solely rely on your Part D plan for everything. If you could pay cash for it and save a lot of money, by all means, absolutely do that. Yeah, I saw that on Instagram and I thought, we got to save that for the future. Do we need to look at our dental, vision, hearing plan too? No, those don't change. We've got a really good one. Where is it? Let me see if I can find it for those who are not familiar. People are always saying, well, one of the reasons why we love our Medicare Advantage plans is because it's got dental and vision. It ain't real dental and vision on most all of them. Like a real amount of a bucket of money that you could spend for the dentist, talking like up to $3,000, $5,000. You can spend it for vision, for exams, for eyewear, for contacts. You can spend it on hearing aids. Go anywhere you want to. No network you have to go into. Dental, vision, hearing, huge bucket of money that replenishes every year. Yeah, that's what we offer to our clients when they ask about dental and vision coverage to go with original Medicare. And you can find out more about that at AmericanDentalCoverage.com. Let me save you some time when you say, why aren't the rates shown on that website? Because again, it's zip code specific and it depends on your age. So if you want information on that, there is a way you can contact us and we can get that information to you. And let me wrap up. Oh, I told Nicole I'd be leaving at 7. Are you licensed to help people in Wisconsin? We've got a whole room full of people that are licensed in Wisconsin and specialists on their Medicare supplements, which are kind of goofy there because they did not adopt the 10 standardized plans. So you have to kind of piece together a plan in Wisconsin to build one. But yes, we know exactly how to do that. Set aside money for your healthcare. Spend it on a Medicare Advantage, and much of that money goes to the insurance company. Spend on traditional Medicare, the money goes to your healthcare. There's only one Medigap plan available if you live in Wisconsin. That's absolutely not true. We've got at least 1,000 clients there, and there are all kinds of different insurance companies, and we put together a plan custom there. They're not a standardized plan, so I'm not sure. Oh, I know what you're looking at. Yep. Please don't try to become an insurance agent and look at the wrong quote engine. That's the benefit of not trying to perform surgery on yourself. I mean, seriously, you're just let a professional look at it for you. And here's how much I charge for that service. 0, nothing. I need dental badly. Jimmy, a lot of the dental, vision, hearing plans have a waiting period for the major services, sometimes up to a year, depending on your state and the policy that's available. I'm going to give you a little secret here where you can get access to a massive amount of savings on your dental, like right now, if the dentist or the specialist dentist that you need to go to, like endodontics or whatever it's called, if they're in these different networks and you can compare all the networks just based on the dentist, I'm going to give you a website. So get ready to write this website down. I don't have it written anywhere. Let me see if I can add it here real quick. This is where you can get a dental plan that has no waiting period whatsoever. It does not have a vision and hearing. It's not real insurance. It's a massive, massive discount for people who need something major done. Because again, most dental insurance has waiting periods for major stuff. But if you go to dentalsavingsforseniors.com, you put in your zip code, you put in the doctor that you want to go to, or just pick one from the best available there, you'll see massive discounts up to like 80, 85% off of what their traditional services are. My family's done this for years. Somebody has something major coming up, we're not paying for dental premium for them. We'll go get one of these plans and go use it literally the next day. The waiting period is like 23 hours. It's the next day, and you can have major stuff, root canals, all the rest of them, extractions, everything done. So that's a little tip for you that will save you money. Dentalsavingsforseniors.com. I live in Ocala. Yes, he covers Florida. I used to go to Ocala once a month, all the time, because the 395th Military Police Battalion, the U.S. Army Reserves, was in Ocala on 40, I believe it was. Yep. In my younger years, I was in the Army Reserves, and I would go there while I was working at the sheriff's office full-time as a sergeant in Volusia County, Florida. So yeah, very familiar with Ocala. And yes, I've been licensed in Florida since 1994. That is 29 years. I've always been saying it's like 25 years I've been doing this, 26 years. I just realized this morning, 1994 was 29 years ago. Look how old I am having done this for this long. Holy moly. Can you help in Georgia? Yes, been licensed in Georgia for a very, very long time. We have all the plans available for the Medicare supplement, and not all of them for Medicare Advantage because we're very picky. Cost me $900 for a crown, and dental insurance paid $1,000. Okay. Chris, you should announce the states he covers. If not all, then it is most. I should announce it. So let me announce the ones that I don't do. We don't do Massachusetts because they're really goofy. Not the people, the insurance companies. Sorry. Hawaii, I'm personally licensed there, but the agency's not. Alaska, I'm not there. Washington, D.C. I believe that covers it. Yep. So pretty much everywhere else. And we have partner agencies that are everywhere. So we can probably refer you to somebody if we don't have it. Somebody said they use GoodRx. Let me just tell you, Michael, a little secret about GoodRx. There was a class action lawsuit that I'm not going to get into disparaging or talking negative about anybody in any way, but I will say, do your research about the class action lawsuit. If you're going to give your information to GoodRx, it's important to know where your information is going. There was an action that addressed that. They were purchased by a Medicare Advantage marketing organization. So just beware that if you are a senior and you're on Medicare and you put your information in on one website, through an existing business relationship, they may be able to market Medicare Advantage plans to you. So just expect a sales pitch, if not just, constantly on their website. Expect that from anywhere you go. A sales pitch about Medicare Advantage. You just never know where it's going to come from. I better get out of here before I get in trouble. I wanted original Medicare, but a benign skin cancer ruled me out. My type was basal cell, which is not malignant, but they refused to cover me. Gary, there's a very finite period of time in which that's going to be an issue, typically 3 years. So if you've had cancer, and I'm not even sure if they actually, since it's just you and me sitting here with 472 other friends, if you want to put this in there, I won't make it public, but did you actually apply, or was the agent ignorant enough not to actually make the application and just told you wouldn't get approved? Many of my friends in this industry don't know how underwriting works, and they get very scared when they hear the word cancer, not knowing that there is a difference between basal cell or malignant melanoma, for instance. So if they actually didn't put you through the underwriting process, my other thing would be, through experience, we know what the insurance companies will take, which ones will take what. And so we don't want to waste our time, if we can at all avoid it, going through an insurance company that won't take a specific condition. We have a huge chart in our office that says, okay, if you have this condition, try this carrier. And if they're all within a couple of dollars of each other, and we've got access to a carrier that will approve you based on your specific condition, that's what we're going to do. And for those that are wondering, would I even qualify through underwriting? We actually have a website that explains how that process works and asks you some of the exact questions that are on those things. But I would say in your particular case, even if it is one that's rejected, then 3 years max, and then you should be able to apply again once you're treatment free. You're treatment free, you can just keep on going to the new one and save money. No previous, I have no previous medical issues with my Advantage plan. How hard it would be to requalify for Medicare. Now, Lori, I understand what you're saying. You don't need to start Medicare again. You want to go back to original Medicare. If you go to our website, which is called seniorsavingsnetwork.org, just the main website, seniorsavingsnetwork.org, they'll have a button there for Medicare help. And then one of the choose your own adventure ways you can go is, I have a Medicare Advantage plan and I want to go to a Medicare supplement. That will fully explain in a video that doesn't talk as fast as I have been talking tonight, and you can stop it and see it. It'll explain graphically what this process is and how we can assist you through that process so that we're not wasting your time. And then based on your choose your own adventure, whatever you need from our website, you can book an appointment so we can see if that's a possibility for you. Just bear in mind, as I went through the timetable earlier, to go from Medicare Advantage to Medicare Supplement, you have 2 periods of the year to do that. Based on education right now, I can tell you this. I'm not trying to sell you anything. This is for the benefit of the masses. You've got October 15th through December 7th. So what we would want to do during that period of time is apply for a plan, a Medicare supplement plan, to start January 1. We can do that. If we start getting later toward December and we still want to get you off the Advantage plan, we will probably punt that until the OEP, which starts January 1 and lasts until March 31. It's another period of time every year that you can go from Medicare Advantage to Medicare Supplement. So as 53 or more million people are trying to look at their Medicare plans right now, if you feel overwhelmed right now, you can just wait and do this process January 1 all the way through March 31. I wouldn't wait till the middle of March, though. Just understand that as you go into the new year, you will be on a Medicare Advantage plan if you've not moved it already. And it would behoove you to look at what would possibly be the best fit Medicare Advantage plan for you now. If a worst case scenario happened and you had to spend the entire next year on a Medicare Advantage plan, I don't want you to just punt that duty and abdicate looking for the best plan for you next year. We should do that as a backup, and we can do that. But we can also apply for underwriting for a supplement anytime January 1 going forward all the way through March. Hopefully that helped. If not, go to the website. I explain it very simple. If you just go to the Medicare help section there. Oh yes, Veterans Day is tomorrow. Thanks for all of you that have served. I've got another story that I've been working on. I've got a friend that specializes in working with veterans and gets them more benefits. I'm going to be working on that detailed information to bring to you, all the veterans. Boy, if I could put that together tomorrow, I could stay up tonight and do it, or just wake up at 3. Maybe we'll do that tomorrow. We'll talk about the veteran options and what those things are out there. That'd be good. Let's see. Chris, I'll call you in June of 2024. That's awesome. Thanks, TW. Looking forward to it. Somebody in my office the other day got in trouble for saying God loves you. And I end every broadcast by saying God bless you. And nobody's going to be able to stop me from doing that. So I will say, with a very heartfelt and a very impassioned, not just saying it as a fleeting statement to go by, I want God to bless you. I hope that you are safe and healthy, not stressed out. I hope things are going well for you. I feel for every one of our clients, every one of our audience members that are going through this high inflation rate, the prospect of war and rumors of wars going on right now with everybody around the world. It's a very sensitive time that we are sensitive to in here. And our crew is working long hour days, up to 12, 13, 14-hour days, sometimes 6 days a week. This team has come together like never before, and we're helping a record number of people. But as fate would have it, there are more people that need our help than we can actually get to by December 7th. So if you've left your information with us and we've not yet called you back, I apologize. We could staff up to probably 100 and 150 people in here, and we still would not be able to get to everybody by December 7th. It's just by design. I don't know why they set this time period up like this. I don't understand it. But I just want to reiterate that if you needed a Medicare Advantage plan or to switch one, that's what December 7th is for. For everybody else, don't give up on us. Let us continue to work through the list to get back to folks, because we can help with everything else the rest of the year. For Part D plan, go to startpartd.com. For Medicare Advantage, if you want to look for yourself without waiting for help, MedicareAdvantageNearMe.com, MedicareAdvantageNearMe.com. And if we can help you, SeniorSavingsNetwork.org. God bless you. Thank you so much for watching, and we'll see you next time. Get some rest.